But I really want Dr. Sadeghi to share, what he sees about my healing, and I can go into further episodes of that.
Yeah.
So,
Yeah.
from your perspective, what first needed to be done when I came in with still on Synthroid for 7 years, and I had just been through a battle, emotional relationship battle, and I didn't even know, to be honest with you, that I was as not well as I was. I didn't know. And Dr. Sadeghi felt my pulse, and he looked at my tongue, and he said, I think you have adrenal fatigue, and he said, I'm not going to say anything right now, but he took some blood, and the lab called you. I remember you said the lab called and said, why is she an outpatient? Like,
right.
It's so as women and as people, and we really have to take care of our children and to keep moving and moving, we sometimes don't even have the space to take a look at what we're feeling. So that was the first time I was like, wow, this really did take its toll on my body.
Yes.
So from that point,
Yes.
what do you remember? Because I know he knows my chart by heart.
So part of the process was that looking, there's some clinical evaluation that can be done, right? So you could do the fingernail analysis, you can do advanced pulse reading, you can look at you can look at the eyes, you can look at the tongue, you can look at the skin, you can look at the deep tendon reflexes. So there's a set of physical clinical findings that's very telling. And then once you have a theory, once there is what's referred to in medicine as differential diagnosis, then you prove or disprove. And the way that we do that is we use, their laboratory tests or radiological studies, if it's appropriate, that you look at. But none of these ever replaces a good physical exam. And far more importantly is, these two devices that we're really given. We have 2 years to sit and to listen. Now, the listening by itself, I think, is incredibly important. There is a way that you listen, and there is a way that we really listen. And the way that we really listen, that by itself could be very therapeutic. The way that we can be listened to is what I refer to it as heart-centered listening, which is, I looked at this incredible, brilliant, sophisticated, human being, not as a person with a thyroid issue, but as a whole person. Because really, when you think about it, if we bring forward the awareness that we are divine beings having a human experience, at our own divinity, at the soul level, we don't have hypothyroidism. Our souls don't have cancer. We don't. It's the body that suffers, you see. So can we be seen whole, just the way we are? And out of that wholeness, then we can be listened to, and then find out exactly where we've been, and then there is a set of physical exam, and then we could bring that level of awareness forward. Not to, what I refer to as, not to be force-fed information, but to just bring the information forward for her to see it. To see that, wait a minute, my God, I've been going, from New York to Florida to here, and I've been dealing with this. Has it really taken a toll on me?
Wow.
Have I been sitting in the kitchen cooking a spaghetti with garlic, and now all of a sudden, Dr. Sadeghi, Dr. S comes in and says, are you using garlic? What garlic? What garlic? Of course. I mean, think about it. We could be using all the garlic and the spaghetti, but it's so innocuous that after a while, that part of us that keeps saying, listen, come on, please pay attention, that gives up. It's like, we're going to save energy. She doesn't listen. So now all of a sudden someone comes in, okay? It could be your physician, it could be your internist, it could be your best friend, it could be, someone that you have a moment that you feel that they're listening to you based on this way of listening, which is heart-centered listening, that they see the wholeness that you are. And out of that, they're like, oh my God, I didn't realize I am using garlic. I am cooking a spaghetti. Wow, and I haven't even been aware. And that's what...
Or I have been holding resentment, or I have been protecting my heart, or I have been, doing all of those things.
Yes.
Yeah, to have somebody actually hear you and go, you're a whole being, and this is what happened with your dad, or this is what you've been holding. Oh my gosh, like that must be a lot. And that's when I started crying. I was like, there's somebody who can hear me and knows that it's not just a thing in my body. I mean, the first doctor that I went to 7 years ago, I'll never forget it. And this is all I knew about doctors. So Dr. SADEGHI was the first doctor that I ever experienced this kind of listening. That man at the time, I had gotten really ill, and no one knew what it was. They thought it was postpartum, and nobody knew. And all of a sudden, I ended up at an endocrinologist to check my thyroid, and she said it's an emergency, and she sent me to a specialist. And the specialist said, on a scale of 1 to 10, you're almost, he said 1 to 10, 10 being in a coma, you're a 9. Here's a pill, take these, in a month you'll feel better. Well, of course I was going to take the pill, but nothing was. And then in that same meeting, the man said to my ex-husband, oh, I know what it's like to live with that. My wife has that, and she gets annoyed at everything. And they started commiserating about how hard it was to live with someone with this problem. And that's all I knew. And then fast forward 7 years later to finally be in the presence of somebody who said, wow, what you've been through is a lot. Yeah.
Yeah, I'm very sorry that you had that experience.
Yeah.
I'm really sorry. But what you're bringing, you know, what you're bringing forward is the awareness.
Yeah.
It's the whole idea of being aware and really making the self-honoring choice. And I don't think that it's self-honoring for us to continuously keep taking medication without doing the work. Without asking, well, let's see, it's my thyroid, it's here, okay, it's my throat chakra, it's in my throat, and why do I use my throat? Okay, my voice box is there, right? Are there things that I'm withholding?
Yeah, by the time I met Dr. SADEGHI, I had already figured out. I remember the day I gave up communicating, when whatever I was doing was not falling upon listening ears. I remember the day I said, I give up trying to communicate. And that's probably when the hypothyroidism started. And even though it was probably in my, in my memory, my mother had it, my grandmother had it, and there's a lot of women, feel like they can't communicate. I think I had already started taking responsibility, like I knew about that, but I still didn't know what to do with it.
Yes.
I didn't know what to do with it.
Yes. That's exactly right.
So do you think that they can, because not everybody lives here and not everybody can see you, can they find somebody who can hear them? How do you do that? How do you, when you're seeing a doctor, and they maybe not like the doctor that I went to, but maybe they're seeing a nice family practitioner, how can they work this with that person? Is that a goal?
Yeah, that's a great question.
Yeah.
That's a brilliant question. So let's look at it. See, what I'm bringing forward is, it's not so much what the doctors do, as much as, can you ask the right question? Can you really ask the right question of yourself, right? Because that's where it starts. See, last night, Dara could have said, oh my God, I think I picked up a virus, and I should rush to the emergency room. And you go to the emergency room, it's sort of like picking up a hammer. Well, you pick up a hammer, it's a nail, and we're going to hit it on the head. So that's what we're good at. We're based on orthodox medical model. What we're good at is, okay, so this is what you have. So it's either a virus or a bacteria. So we're going to draw your blood, give us a urine sample, and we're going to get a culture, and then we might even get a tap of your spinal fluid inside your spine, and then we're going to tell you what, and then we put you on a medication. What she did was different. She asked herself. See, she came from the place that she realized that she has the ability to respond to what was happening. And really, that is, when you think about it, having the ability to respond, it's the definition of
responsibility.
Responsibility. That, you know what, wait a minute, life is fair. There is certain amount of fairness to it, that I'm here, it's not an accident, and I can handle this. Now, from that place of empowerment, then you start checking in with yourself, what is it that I need to do right now? I got a fever and I got chills, and I remember Dr. S mentioned something about this particular homeopathic medicine, and then you communicated with me.
Yeah, I said, is that okay to take, or should I take it? And you said yes.
Yes. And then she took it and she got the response, okay, physiologically. And that gave her the time in terms of moving forward and then making the self-honoring choice of, okay, during the past month or a week or the day, how have I been that this is my experience? And you had a particular...
I had 3 days ago some severe stress.
Yeah.
Severe, which I cried the minute I heard the stress, and then I just kind of went, I don't know, it seemed like the stress needed to get out of my body. So what I did, that when I get a fever, I know that something wants to come out. So I feel like I'm detoxing something, whether it is a germ or it is emotional stress or whatever it is. So I said, well, what can I do to heat it out? And I'll take a bath with Epsom salts. I'll drink lots of coconut water to hydrate myself. And I'm going to just sweat this out. I'm going to bundle myself up, and I'm going to get it out, because tomorrow I'm going to be 100%, and that's that. Now, don't get me wrong. There are moments of fear. There's moments of fear. There's moments of fear when I went off Synthroid and I was on, the Westroid, the natural medicine. There were moments, maybe 2 times in that month, where it really felt really bad, where I was like, is this crazy? Because all the other people are like, you're crazy, you can't stop Synthroid. And I did have moments of fear. It's not that they don't come, but then I say, oh, okay, well, it's okay. I've healed myself of the bigger things, the fever and the chills. It's just something that needs to get out of my body. So I think, yeah, taking responsibility. And also another thing is sometimes, and I don't know if this is for you, and for you, I don't know if anybody else feels this, but sometimes it's almost like, boo-hoo, I want someone to take care of me. Sometimes I get sick just to prove that there is or isn't somebody there to take care. And so there wasn't anybody there to take care of me last night, and I said, okay, guess what? Take care of yourself. And of course